one thing I haven't heard that I know is an issue for many people, especially persons working or who worked in the private sector and were laid off because of COVID-19 and were only getting 50% of the salary or less. They still have mortgages and rents and loans. At a policy level, something needs to be done to help persons, and in addition to the food, which is also critical. But we have rent and mortgages and loans that have to be paid, and something needs to be done to address that. Dr. Box mentioned the need for us to cordon off regions that have high levels of infection rates. I agree totally. Indeed, the army and the police have been missing, I have to say, and it will be really great if we can have more of their presence, especially at the borders. The imminent threat to us is Brazil and persons who are traversing, as Minister DrIrfaan rightly said. A lot of persons in Region 9 go to Brazil in search of jobs and income, and maybe indeed also pensions. If pensions is part of the reason why they travel, can we explore the possibility of setting up some sort of money transfer capacity? So they don't have to go in person, but there can be transfer of monies across, and they can collect what they have to collect right here in Guyana to reduce that risk of spreading exposure. The other challenge we have sometimes is the travel of passengers sick with COVID from the hinterland to Georgetown. There is a reluctance usually from the private sector, the airplanes and so on, to transport such passengers. So we need to think in long terms, how can we move infected passengers if we have to? I mean, it's better still if we can treat them where they are. But if they're really critical and have to be moved, what are the options? I know also right now in Region 9 where we had the recent 30-something cases, there's a challenge with the surveillance and getting to the cases and the contacts. So transportation in Region 9 right now for surveillance is a huge issue. So if some immediate measures can be put in place to help with that, it will go a long way.